Very good evening to everyone. We are going to start our today's session of our webinar, and indeed, it's a pleasure for me to take this session and then to discuss about the various assessing methods through simulation. In the last and previous webinar series, you uh, the one of our colleague and the simulation expert Pedro has taken the session and he has discussed about the foundations of simulation based assessment, and I hope that you have the concept about that, the how we whenever we use that the simulation techniques in our assessment, how it will be, what are the principles of it and what are the techniques for it, and what's the foundation, what are the concept you should clear about it before you jumping into it, that the simulation based assessment when you do either for the nursing students or for that the nurses. So I hope that you have the clear understanding about that, how it is different from that the what written demonstration we take and what's the difference between that the simulation based assessment. So today we deep dive into it and we'll discuss about that the what are the different uh, methods of the assessment which or for through which we check that the competency of the students or the nursing students or the nurses, and what are the different methods we should use, and what we called it whenever we use the simulation based assessment, how we have to use those methods of simulation based assessment. So let me go through with you on that. And see, you all know about that the what are the our traditional assessment methods, which we are still using the some of the traditional assessments. And if you look into this slide, then you can understand that the how we are doing it right now. We are doing the written examinations, and the most of the time during the practical, we do that the Viva voice. And there are the limitations for those kind of the traditional assessments which we usually do it, and sometimes I see that the most of the times we also ask that the we call, okay, we are doing the OSCE and we have the checklist and we just ask the students what they are doing, which we consider it's not an OSCE assessment, it's exactly as like your written examination. Instead of students writing it them, you are just asking and then you are putting the tick on their verbal response. And in traditional assessments, you see that it has a lot of limitations, right? The examiners kind of the bias, the poor skills evaluation. Sometimes the students, they are not able to evaluate in each and every component. But whereas in the modern approach, where the our respected Indian Nursing Council has also focused on that, the OSCE-based assessments and the simulation-based assessment has to be introduced into the nursing colleges. The ultimate goal is that how we can come up with that the competency framework, or we have to show that the once the nursing students they come out from the nursing colleges or from the nursing school, they should be clinical competent, not only the clinical competent, but also they should have that the professional behavior. To include all these things, how we can evaluate them. Maybe we are giving them the during the training the best training. Maybe we are giving them the best teaching methods. They are going into the best hospitals. They are getting that the clinical exposure. But at the end, it comes into that the evaluation when we evaluate the candidate. And when we evaluate the candidates in the simulation based manner, we have that the different approach. And in that, it is not the general evaluation. In traditional evaluation, usually what we do, we teach the one topic and then we say, okay, we taught about, for example, pneumonia. Okay, can anyone can tell me what is the definition? The one person raised the hand and then he said that this is somebody can you tell me what are the sign and symptoms? And we assume on the basis of those response, then whole class understood that the concept. And on the basis of that response of the students, we evaluate that how effective was the teaching, or maybe the students able to get it or not. Whereas into the exam written examinations, sometimes we ask that the questions to the students about, and from the written examination, we have everybody is having that the same questions, right? But the students they give that the answers according to their capacity. Whether they pass with that the 100%, 80%, or 60% doesn't matter, they pass the exam. Third thing is that in the traditional, if they are into the Viva voice, or we are asking the questions to them, we know as a teacher that what's the capacity of the student. And according to that capacity, we ask the questions, right? But however, those method does not work when the student, when we are preparing the student and we are preparing the student to take care of the human life. And when they go into the reality, they should be the clinical competent enough to take care of the patient. So for that, it is important that everybody has to meet that the same standards, and everybody has to be judged or assessed into the same platform with that the same clinical standards. And that's why this modern approach of OSCE and simulation, which is the complete competency framework, and that competency does not include the one component. It includes that the knowledge, skills, attitude, and judgment. Judgment in the sense that they should be able to talk, they should be able to do the critical thinking, and they should be able to do that the clinical judgment. And that's once we do those assessment, that assessment can show us, okay, that how much the student or the nurse is the capable or competent enough. Whereas if you see in this slide, and if you see that the every individual component, be it the knowledge, the skills, the attitude, we teach these things, we train the students in all different aspects of it, right? We teach the theory separate, we demonstrate the procedures or skills separate, we talk about the attitude separately, and we do that the maybe we do or do not do that the clinical judgment scenario based trainings to them to improve their critical thinking and clinical judgment. Whereas after teaching these all these components separately, when we would like to do the assessment, how we can assess the all the students at one shot, right? All these things has to be assessed simultaneously. And for that assessment, we need to have that the simulation based assessment, because that simulation based assessment include these all these components when you evaluate the uh, students. So we all know about this model of Bloom's taxonomy, of theory of Bloom's taxonomy, and we know about this pyramid very well, right? And this pyramid talks about that the when we are into the nursing college, or you see that this traditional exam, or when we are into, or the students are in the nursing college, they have the vast theory knowledge. They know that the how the applications, they know how to demonstrate, we train them the demonstration of different procedure, but at the end that the time comes when they have to perform, which is on the top, that the into the clinical practice. And there we need that the from where we have to demonstrate to the practice, and we prepare the demonstration of these skills, we are preparing them to do that the in the real or the clinical practice when they come into that the real life. So we can no longer just test what students know. We must assess what they can actively demonstrate in the clinical controlled environment. The controlled environment is we replicate the reality of real life into the simulation. The simulation is the replication of reality, but that is in the controlled environment where they are allowed to do the errors, and they can do the trials and trials and trials. That's the thing, is that we have to create the same scenario, the same situation, what they supposed to do into the clinical situations. And I always used to give that the basic example whenever we teach that the IV cannulation. How do we teach the IV cannulation to the students? We teach the IV cannulation, okay, this is the procedure, the steps of the procedure, this is the list of equipment, and this is the tray which setups, right? But, and in this way, you have to hold the hand, in this way, you have to hold the cannula, you have to rub it, clean it, and then insert it into this angle. In real life, it does not work into that way. If the patient refuses, if the patient says, no, sister, mujhe nahi, do not do it on me, it is very painful, don't do it, my kid is crying, right? I do not wanted to have that. I just wanted to have to make my hand in this way. Or the patient is with that the edema, or the patient is having the other physical conditions where you are not able to put those cannulas into that the place where you have practiced. What will happen? That's the critical thinking. That's the communication skills. That's the behavioral skills, which we have to include into it. Right. So that's the thing where we teach and train the people into that the those training aspects, and then we have to evaluate it. So let's discuss today about these two methods, the OSCE method, how we do into evaluation, and the simulation-based evaluation. So we'll discuss one by one what is OSCE-based evaluation and what is simulation-based evaluation, which we have to use into that the simulation-based training or after the simulation-based training or whatever the training you did, but to evaluate the candidates, how you can use it. So to talk about the OSCE-based, and you look it into this web, what the components we should have into the OSCE examination. We all know about with the name OSCE, it's objective structured clinical examination, or somewhere we called it the observation structured clinical examination, where we have to observe and we see that the what the students are able to perform. So it should be driven by the checklist based scoring. The instructor should have that the checklist. They have that the checklist whether they are able to perform or not able to perform. In that checklist also we put it that the what are the red flag items, which are the critical components which they should not miss by any chance, because sometimes the students they start that the procedure from the different routes, but that is okay. But until and unless they should cover that the all the critical elements which are into that the particular procedure. The structure of the OSCE, it is the fixed, it is the timed station. Every student, they get that the time allocated to perform that procedure in that limited time period. Exact same task for all candidates. We cannot change. As I said, that we cannot change as we usually change into the traditional method. If the candidate who is with that the low caliber, we ask the easy questions from them. If the candidate is really very good, we ask that the difficult questions from them. That never happens into the OSCE. OSCE is always similar for everybody. It should be exact same task for all candidates. You cannot make it complicated. You cannot make any switch into it. It should be safe. It should be clear. And the criteria and the consistent result across every cohort. Whatever the batch is coming, if the candidates who came yesterday and today or the same batch, it should be same. It cannot be the different from this college to another college or from this institution to other institution, from this category student, from this category. No, the results across it should be from every cohort. You have to have that the fair and standardized evaluation. So in OSCE, this is the very important thing that what topics we should have. Now, how we develop that the OSCE checklist and how we design that the OSCE, right? So that's important. First of all, we should identify the competencies. For which competencies we have to do that the OSCE assessment, which topic we have to take, which particular procedure which we have to take for OSCE. Every topic we do not take it for OSCE. Some of the topics we take it through the simulation-based training assessment. Some of the topics we take it for OSCE. Some of the topics in the we take it only for Viva. Some of the topics we just ask them to observe. But for OSCE, we have to decide that the what identify the what competencies which we have to check into the students. On the basis of that identification by the instructor or the facilitator, we have to categorize them, whether they are related to the procedure, whether they are related to the any assessment for the procedure. As I give the example, procedure of IV cannulation. Assessment, whether this OSCE is related to the assessment in the sense where they have to use any kind of the scale to assess the patient condition, or the patient assessment for any tool they are using it for, even for vitals, that considered under the assessment category of categorization of assessment for OSCE. Communication, that also you can put it into the OSCE. How do they have to do the communication with this patient? That's the separate module you can make it, or you have to identify the competencies. I have to check the competencies in the communication skills. Then also you can categorize in the emergency responses. For example, the CPR scenarios, lab reports, on of sudden that the patient's condition is deteriorating. They immediately look into the parameters, right? So those emergency responses, they also have to learn how to respond and how to identify and how to check the patient condition. So first you have to identify which level of students you have, what did you taught them, in which level would you like to do that the OSCE. Then you have to divide and categorize the OSCE in which parameters the OSCE I have to create and do it. Then allocate the weightage. Okay, how much I have to for the procedure, how much for the communication, how much for the assessment. And then on the basis of that, we design these stations. Okay, so you must have seen that if you have done ever the OSCE, you see that the different stations are set up for the OSCE. On the basis of these allocation and the category, you design it. We never put at all these things in the one station. That's not in the OSCE we do it. It should be categorized, and we have to do that the multiple stations for the reliable and then the exact result and the transparent result, and to check that the clear competency, as many as these stations which we can do it, that will be more better. Then we'll design that what the equipment you need for that station, what the parameters scales you need, what the simulators you use, what the if you need that the standardized patient, whether you use the standardized patient, consumables, what you need, all these things according to that categorization you need to have. So this is just an overall blueprint about to give you a sense that how the OSCE develops. Now, how we design that the evaluation structure. So stay what the checklist that examiner is having, along with that what are the things which we have to prepare. Now we understand in the previous slide that we have to identify the competency, we have to categorize it, allocate the weightage, that how much will be the procedure, communication, assessment, emergency response, and on the basis of that, now what is that the evaluation structure. So we should have that the station title, what are the competencies you have to assess, right? Okay, this is the procedure, communication, your station title. A student's instruction should be very clear. You have to have that the clear instructions for the students. See, you cannot make that or you cannot interrupt during the OSCE. So before in hand, you should clear all the instructions to that. This is the station. This is station number is 5. This is for this. You must have this much time. All these things you can have it here, and then you can start at this time. All these instruction you should give. Sometimes before with the instruction, you should also give that the familiarization time to the students. So before starting it, you can give the 2 to 3 minutes, 5 minutes maximum to go and then look it into and do the familiarization, where they can see, okay, that everything which I have to use is there, all the equipments are there, everything is there, and read all the instructions which are kept on the station to go ahead with that, because as I told you, it is a timed assessment. The candidates or the students have that the limited time. The examiner checklist, the examiner having that the checklist which has the gradings, that those grading, whether you are perform, not perform, all these the checklist as per that the procedure will be mentioned there. It starts from the patient, the candidate, how they greet with the patient, and it is designed as per that your category, how much weightage you put it for the procedure, the communication should be there, or if it is needed. If it is not needed for every procedure, does not the communication will not come, that the emergency will not come. But yes, of course, we wanted to make sure that the everything should be covered, so that all these check in the checklist, those things can come. Equipment list should be ready. What are the equipments required for that? Time allocation, you should have that the buzzers, you should have that the some clock or timers which they can immediately stop or stop their performance. And for the debriefing, you should have that the expected outcomes. The before Without learning objectives, we cannot design our OSCE until unless we do not know what we wanted to have from them, right? So whatever we taught them, we do not want that everything they have to perform in the. But you should know that what are the things, what are my learning objectives. On the basis of that objectives, you have to have what will be my expected outcome, how much they should know, how much they should able to perform, what are the things they should not miss it, that you should have that the expected outcome. See why I'm saying that the expected outcomes, because if the some of the candidates, if they are really doing good, and if some of the students they are not able to perform, as I said earlier, that it should be same for everybody. You cannot change your expectations from the different students, and you cannot change that the protocols for them. You cannot change your marking scheme according to them. You cannot change that the examiner's checklist. So examiner checklist is same, the station is same, the procedure is same. So everybody has to be judged in the same. So you should have that expected outcome for whole batch. So that will be the transparency will be maintained. Now, for example, with that, if the student has to check that the radial pulse, right? So, and you give that the 1 minute to identify the rhythm and record the findings, right? So, how it will work, right? So, step one, hand hygiene, introduce yourself. They go in front of the patient. Hey, my name is Jaideep. I will be your nurse for today. We are going to check your pulse. Would you allow me to do it? Right. Then next, explain the procedure to the patient, what I'm going to do. The third, correct size identification. You also correct the identification, accurate counting, and then the documentation. Right. So it is a sample sheet, the checklist. I just put it here. What you're gonna do it into it, right? Hand hygiene, procedure explanation, site identification, and documentation. This is your checklist. But we also have to see under that, if you want to put many things, you can put it. But we wanted to make it similar for everybody. So in the OSCE, because we are not making anything which is the scenario driven or the simulation driven. So we are not putting anything which are related to and making them any complicated, or it is not something like that that our scenario is going or running scenario where after checking the rhythm, I am saying, okay, the rhythm is abnormal, so what the next you have to do, then what next you have to do, what to whom you have to inform. No, it's just a OSCE to check that the whether you know that the standards of doing the procedure or not. So in the checklist scoring, right? The procedure explored, yes or no. Safety checklist, yes, of course, you have to, and documentation. There is no if and buts into it, right? Whereas in the simulation based assessment, which we'll talk later about it, in there, a lot of if and buts come. Instead of doing this, if the candidate perform that, what will happen? Instead of giving this to the patient, you give something else to the patient, then the patient condition deteriorates. What is the next step? What is the, or you are still working on the patient, but the saturation is keeping dropping down. What is the next step? So when we do that, the simulation based, then you will have the different steps and then your scenario is running. But here in that, the students even then perform yes or no. There is no other option. They do or they don't do it, right? And how you can make it better, you can have that the rating scale from the with that the technique, accuracy, and communication based, and you can make your rating scale on the basis of that. You can give them either 0, 1, or 1 to 5, wherever you see it is required for the improvement. Usually in the OSCE, we write the comments, but instead of that, the rating scale, we use that the checklist scoring with yes and no, and write the comments of the where it is required for more revalidation or required that the more improvement or something like that, or is if they have done something good. So it's up to you that the what method you can use it for the OSCE. It can be rating scale or it can be the checklist, but it should be strict. So now this is the things which can make your OSCE very precise and the accurate. The strictly trained examiners. The teacher should be trained in OSCE structured examination. It is very, very important. If the facilitators or examiners are not trained how to take the OSCE, if they are not on the same page, then you will not get that the exact result. It will be biased result as similar as like the traditional examinations. So all these teachers first, all the examiners first has to be trained into the same procedure. They know that the same standards, they know that the how to do the OSCE. There should be standardized instructions which is applicable for each and every candidate. Before starting that the um, directly started or assigning to the students, you should always do the mock or pilot testing of OSCE, because sometimes we imagine that I can finish this task in 3 minutes, but it will never happen. So always think that on the basis of your uh, equipments, on the basis of your resources, make it a test project or the pilot, just do a pilot testing to run it, whether it will be able to finish in that particular time period or not. Then only you will put your instructions. As I said, that the multiple stations to offset the errors. If you make it in one station 100 things, it will be disaster, because it will be difficult for the student and as well as for the examiner to assess. So this is your reliability shield. How you can be make it more reliable, your OSCE. You should have the clear scoring rubrics. You cannot have the in the one point you can give that the rating scale, and in other points you are giving that the yes or no. No. Either it should be the checklist with the yes or no, or either it should be the rating scale. It should be similar in every way, right? You cannot say, okay, if this procedure is bigger, then I can give 1, 2, 3, 4, 5 marks, whereas in the next component I can give the yes or no. No, otherwise it will be the bias and you are not using the correct checklist rubrics. You have to have the trained examiners, you have the standardized instructions, and always do that the mock or the pilot testing before starting it. So I hope that you understand about that, the brief about that, the OSCE, because in 1 hour I cannot teach that the whole OSCE, but I can give you the overview that what exactly the OSCE means and how we have to conduct that the OSCE for the particular topic or the particular procedure. Now jump into that the simulation based assessment. When we say the simulation based assessment, it is a scenario based driven simulation, right? So the difference between the scenario based simulation and the OSCE, as I said in the OSCE, it's you give that the checklist to perform this. Whereas in the scenario based, we are giving a one context to the student, and in that context, we are asking them to perform that the what's supposed to be done. So what happens into it, the purpose of this scenario based is to use that the realistic clinical scenarios to assess the performance. Performance means the clinical task, critical thinking, and also we also check for the communication, behavior. So it should be in a safe environment because it's a zero risk to the real patient, right? Whatever we wanted to have them to learn, we give them the real situation into that the patient's simulated room. So as I'm keep repeating that statement, the simulation is the replication of reality. So whatever happening into the reality, you have to replicate that the same situation and same scenario here, allowing the students to do the errors here. They can do the hundred of errors here because it's a safe environment. It's a replicating high stress. You have to replicate that the same stress. You have to give them the same condition. If you are visiting to the patient, at the same time the patient relatives are also screaming on you, the patient is also in trouble, and then somebody is also calling you. How do you manage the stress? And in that stress, how you are going to do this situation? And we allow them to think critically because as I give you the similar example of the basics example of that the cannulation, if you do not give them the training, if the patient is refusing for not having that the not I'm not going to take that the cannula, or I'm not going to take the medication through that, or patient is refusing, or patient is not allowing you to do any of the procedure. See, if you do not train them, the students, into those situations now, in the reality, when they go in front of the patient, they do not know what to do because they have been trained only to how to give that, to how to inject this injection or how to insert the cannula. They are not into trained into those scenarios that if the patient refuses, what should I do? If the patient shake his hand in between, what should I do? Right? So that's the thing. And then what happens in that time, whatever the things come in their mind, they immediately act. And then we put and we say, okay, this is the error they have made. No, because we never allow them to practice the errors into the same environment. That's the scenario based training. You have to allow them with the various errors, whatever the common errors are happening in the reality, related to the communication, related to the procedure, related to the identification for any reason. Whatever the common errors are happening, we know all the stories. This is happening, this is happening. Every day we go in the hospital, we know it. But how we can train those errors and through those errors, how we can train our students, that comes into the scenario based training. And during that scenario based training, how we once you train into the scenario based training, then only you will do that the you can be able to do that the assessment, which is scenario based assessment for decision making. If you did not train them into that, you cannot take the assessment. So it is very important While I'm talking here about not about the training, I'm talking here about the assessment, but as well as I'm saying to you, it is very important to train the students into the scenario based training. Because when you do the scenario based training, then you can expect them, they can be evaluated in the scenario based assessment. So the scenario based assessment is where you have to do to check that more on the critical thinking, clinical decision making, clinical judgment. These things has been judged during that the scenario based simulation. For that scenario based simulation, we need that the low to high fidelity, right? So the name with the fidelity in the previous class, in the previous webinar, he has discussed about that, the different kind of the fidelity and how you use those words of fidelity, right? So the different fidelities we use according to that the level of the students, according to that the which grade they are, what assessment we are going to do, and the most important thing, what is my objectives. See, you cannot make that the high fidelity to check only one. The objective does not require that the high fidelity. If your objective is that you require the high fidelity, then only you have to think for that how I can make it more high fidelity. And see, the fidelity means that the how closer to you are to the reality. It does not mean that you should have that the high fidelity mannequin, right? Yes, of course, the high fidelity simulators are that which are more closer to the reality. They can breathe, they can cough, they can talk, they can cry as much as closer to the humans. That's why they are called the high fidelity. But if you have the standardized patient, they are the best one, right? So the fidelity means how closer to the reality, how close you are, the context you are putting it related to your reality. If in the hospital you can set up the same in your simulation lab as exactly as what is happening in the hospital, it's the high fidelity because you are making it the closer to the reality. So in that, according to that, the what is your objective, on the basis of that you pick up what fidelity I need to use in my assessment. For example, for this cannula, I'm taking the same example. If you wanted to make this scenario for cannula, you could take a standardized patient. But yes, of course, the standardized patient, you cannot insert the cannula. At the side of that, the standardized patient, you can put that IV arm. And in that, on the behalf of that IV arms, right, or on the behalf of the mannequin, that the patient can speak and he can act as like a same human being. The standardized patient can talk. The students can become the standardized patients and they can talk. Then it makes more real. You can prepare the script before, you can prepare the actors or the standardized patient, how you have to talk, what you have to respond. When the nurse comes, this you should say, this you should not say. And then look, it will work as like high fidelity. So how much you can make it more closer, that is important, but that's also depend what you want to assess. What is your objective to assessment? If your objective is just to check that the skills, you can go for OSCE. If you want to check that the okay, I wanted to check the communication skills. My objective is that check the communication skills. Yes, of course, you need that the high fidelity because in the communication, the patient has to speak. You need that the standardized patient in that situation because the patient has to speak. If you want to check the response into the emergency, yes, maybe you do not require that but you can make that the parameters change. You need that the high fidelity equipments, you need that the monitors in your system, you need that the certain scales in your simulation, which requires that the how I have to assess. So on the basis of your objective, you have to design that. And you do not need to put everything, and you cannot say, no, my objective is to assess for that the patient, for pneumonia patient, to take care of pneumonia patient. It's too much. Because in pneumonia patient, many things can come. He has to check for the coughing, he's check for that the vitals, he has to check for that the respiratory exercises, everything. No, you cannot do that. Right. So if you wanted to check the assess the clinic, clinical judgment, critical thinking on a particular thing, then you require that the scenario. And then your scenario should be small enough, but your time period for the debriefing will be more. Because if suppose during the cannulation, if the patient refuses, but the nurse said, no, this is the doctor order, I have to do it. Or one nurse say, okay, if you refuse, just sign on this form and then I'll do it. Or the third nurse respond to that, okay, wait, let me call the senior nurse, you should talk to the senior nurse. You will get the three different responses, which is right. You do not know, right? But you have to check during the debriefing time, what was in your mind at that time you decided this. Why did you decide to call the senior? Why did you decide to do that, to take the consent from the patient? Why did you decide, no, you have to force the patient to get that decaf, right? If you work on that in the debriefing, see, the protocol is saying this, we have to, according to that, that person will never ever forget it in her life, that what is the protocol of this. That's the way we make it the scenario based learning and then scenario based assessment similarly. So how we can make a clinical scenario for that, the scenario based assessment, right? The pillar one is the baseline, establishing the clinical case setting, defining the learning objectives. See, learning objectives are very important. Then you design the case, you write the script, the base of the script, the patient is 54 years old, the admitted into the hospital with that the case of that the pneumonia. He had this the second episode of the pneumonia. Last 2 years before also he had that. His family is also with him, his elder daughter is also working, this boy is working into that. This is all these things you can make it with the learning objectives. What do you want to assess? The progression of the case, as I said, the running case, it's the progression of the case. It triggers, you can give it, put it into it, the pre-planned, the thing, okay, when the patient comes, this is already the patient vitals are this, right? The patient come into the emergency, or you can say the patient is in the hospital already admitted. All of a sudden, it was his in the morning, his saturation was 92%, right? He was on the oxygen, right? So some the triggers or the pre-planned conditions, you can already put it in that. To progress the case, you can put that the triggers on which situation you can say. While talking to the patient, all of a sudden you check that these from the saturation and you see the saturation is still dropping. Okay. So now the student has to think, what is the second step? Should I keep that the oxygen again? In the same, should I call to the senior? Should I inform to the doctor or should I check into the doctor's order? Right? So different things. So as the case progress, you put it to certain conditions, and those conditions, the certain conditions will hit to the student, and then the case is also progressing the same time. And also you can judge that the critical thinking and clinical judgment of the candidate. And your assessment criteria is that the on the basis of your objectives, what the you measure whether they fulfill that the objective, and then you will discuss with them in the debriefing what was wrong, what was right, how the case was progressing, what did you do, what you should not do, right? In that way, that is the clinical scenario based evaluation or the assessment. So it takes time. It takes time. It cannot be finished as fast as the OSCE. Simulation based, scenario based assessment takes time, but you have to prepare before that the assessment. Always remember, you should not have more than three learning objectives. You should have maximum three learning objectives. That is enough to evaluate that the critical thinking and judgment of the student, because you cannot judge the all these things into it. You should have that the what's my parameters, what's my expected outcome, and your this is my learning objective, that during this situation whether they are able to manage this or not. Or would you like to have check the only the communication skills, or would you like to check only that the whether the students are able to identify those triggers, whether the students are able to identify the emergency responses, right? So that's the flow, how the clinical scenario based assessment has to be done. So if you see that the this is just an example that you put it in the brief about the patient. Okay, this is the baseline information. The patient with the 45 years old male, he was admitted. Her daughter is accompanying her. She was 12 years old. She's still in the school. On a sudden, that she's on the holiday. Whatever you want to make it, you can make it, but just a base information. The patient is with having the palpitation, dizziness, and all. And all of a sudden, you can say, okay, while checking that the ECG, you find out this, and then show it what they have to identify, what they have to assess, what they have to recognize, to whom they have to inform. Now that the flow is your checklist, what they have to do. Immediately check and interrupt the vital signs, recognize the patient's condition, inform to the doctor. All these things you have to provide immediate protocol driven action, what they have to do. That's the flow will work. That's your progression of your scenario. So these trigger points all of a sudden you have to put while doing something. You can say the patient is coughing on of sudden, and then patient is saying, "Oh, I'm not feeling well." What you do need to do, right? Do you immediately go and check the BP, or you were doing some procedure? You will continue to do that procedure. That all these things we have to put in the scenario, which is happening in the reality. Even if you are giving that the check training on the BP for the first year student, how to check the BP. Just to teach them also, if all of a sudden the patient, during the checking the BP, if patient is saying something to you, what will happen? What are the different situations when the patient's BP recording can be wrong? What are the different scenarios? Don't just teach them and train them into that the right environment, everything goes into this way. No, these are the different factors which can change many things. So that's those scenarios we have to implement. So if we talk about that, the simultaneously performance domain. So we discussed about it, the scenario based, we discussed about the OSCE, but all these things, if we have to check it in one, right, the simultaneously performance, we have to check that the clinical skills, teamwork, communication, decision making, these all four components you have to check. That's the web. But that happens in the simulation based assessment. OSCE is separate to talk about the objectives. The scenarios are different to talk about the clinical judgment. But overall, when we talk about that, the how we can go simulation based assessment or simulation based assessment, then you will give us the bigger scenario where you can judge that the clinical skills, teamwork, communication, and decision making, everything, right? So OSCE is different, scenario based assessment is different, and simulation based assessment is overall counting everything into that. So the most important thing is that if you wanted to have this assessment to be done, the educator is the most important part, right? Educator should know, because educator is the designer who know that the what scenario I have to design. He is the facilitator. He or she should be with the student to facilitate that scenario. He should be the observer. He should know that what are the critical points I have to observe, what's my objective, how I have to observe the candidates, what are the critical points I have to measure. They only have to evaluate. As an evaluator, they have to evaluate, and they have to be the debriefing leader. They have to initiate the debriefing. So ultimately, that one educator has to be this multitask, or he should be expert into all these parameters. Otherwise, we will go into the same way what we are practicing into the tradition. Ask one person, evaluate the students according to their categories, evaluate the students according to their IQ level, and we are not able to make it that everybody has to be in the same. So that's important. And debriefing, it is very, very important. If you have done the simulation course, if you know that the debriefing is the heart of the simulation, right? It's the most critical part. Conducting the scenario, preparing the student before that, the simulation, it's a this much. Conducting the scenario, acting, it's just only for 5 to 6 minutes. But after that, what the discussion, what are the learnings? That's the debriefing. Why did you do that wrong? What was supposed to be done right? Why did you do this right? Right? That's the bigger piece of the structure of simulation. So that we have to focus more. And that's where we can evaluate their critical thinking and clinical judgment. We talk about critical thinking and clinical judgment a lot from the beginning of first year of nursing students. But how to practice that critical thinking, to develop their critical thinking and clinical judgment, it is important to create that kind of a scenarios which is happening in reality. Then only you will find out, hey, this is the way to think. So they will never do those errors in the reality, which errors they can be allowed to do it to the simulation environment. So the difference between that the OSCE and the simulation is that the OSCE focus on the targeted isolated skill validation, performing the one procedure at a time. It's a timed, short time. It's have the timed intervals on the particular time period. It's a timed framed assessments. Format is rigid. Students rotate over that these skills stations. And assessment scope, it's an individual performance. It's not a group performance. Every individual person has to come and then will be evaluated. Whereas that the simulation based, it's more focused on the decision making. It's a longer, as I said you, it's not a short. It's take time, as I keep saying. Format is it's evolving the scenarios, right? It is not just to give one particular procedure. You have to give the scenario. The scenario can be the progressive scenario where you can give that the triggers, you can give that the sudden onsets, and that we evaluates individual, and also we evaluate the team dynamic. If you have done the ACLS course from the AHA, you know that the team dynamics, right? Everybody does that according to the scenario, but also it has to be evaluated that how we have to talk. So in that also we include that the paramedicals, interdisciplinary, all these communications can be involved here. So if we talk about the holistic ecosystem and what we have to follow, that the OSCE assessment, yes, and the simulation assessment for the complex scenarios. So in this step one, use the OSCE for the fundamental skills mastery. In the step two, then you can ask them that I'm giving you this situation to enter into it, right? So for example, if you are giving teaching to the for the cannulation, again, I'm coming to that cannulation. The OSCE means you just teach them or train them on the steps or demonstration of how to do that, the cannulation. That you can have that just OSCE, written demonstration and demonstration. But in the different situation, what can happen when you go and give that the or insert the cannula? What are the different situations can come? That's the you have to put those things into the scenario and situation, or this particular portion you can be add into the any of the scenario, right? So the steps of, but how we can intervene it, how we can implement it into the institution, right? See, always we talk about it, we know about the OSCE, we know about this and that, but the most important thing is how you have to implement that in your college. The implementation, the first and most important thing is faculty training. If the faculties are not trained, it is difficult to do that the OSCE because they are not on the same page. Infrastructure setup, which yes, you require that the lab, you need that the essential simulator. I put it essential simulator. I am not putting it here that you need the high fidelity simulator. So be careful. You should have those things which are required to assess. Please do not do that practice. Put it into the tray and set up the tray and put the slip. Kidney tray is missing and put the slip of the kidney tray. No, no. In reality, it never happens like that. In reality, they do not do into like that way. So it's better to do that what is happening in the reality. That's the simulation, right? Develop the library of the OSCE stations, various scenarios, pilot runs. Before doing it, do the pilot. Do not dump the student directly into that because it will be chaos. Trust me, we do many OSCEs and we do run before it, then only it runs smooth. Otherwise, because if one student is taking more time, you in between you realize, oh, this is missing, oh, we did not think into that way, everything will be spoiled. So better to that. And then you have to fully implement it. You can do it in your curriculum, right? So there are some barriers which everybody talks about it. Lack of advanced lab. Again, I'm saying that you do not need the high fidelity lab. Fidelity means that how closer to the reality, as much as you can make it with the smell, with the even lights, with the everything, you can make it. Untrained faculty, yes, this is the challenge. If your faculty never went into the hospital, they do not know. They do not know what are the challenges. They do not know what is in the reality. It is always challenging to do that, the OSCE and the simulation based assessment. It will be again a bookish assessment or the bookish uh, OSCE. Uh, Time constraints, everybody talk about it because you have the batch of 60, 80 students. Yes, if they are like that, you have the multiple stations or multiple trainers. So that's why I'm saying that you have to train that the multiple trainers. OSCE cannot be done for 50, 60 students in a day. You have to split until unless you do not have that the more faculties or the more uh, resources. So at the end, I just want to say that the ultimate return on educational investment is that the clinical competencies are up, and that clinical competencies we can make it if we introduce this OSCE based and scenario based training plus the evaluation. We were talking in this webinar about the assessment, but before assessment, it is also important. First, you have to also use these techniques in the training. Then only you can do that the uh, assessment. If you do not do the training, you cannot do the assessments. So thank you so much. And if you have any questions, you can ask me, or if you want to put any of the questions in the chat box, you can ask in the chat box too.
Hello, sir. Good evening.
Yes.
Sir, Sharon here.
Yeah.
Sir, these are the two assessment methods. One is OSCE and another one is simulation driven. In
Mhm.
simulation driven, what are the measurement tools we are going to use for the assessment of skills and competencies?
We use that the different tools for the debriefing, the Pearl tools we use usually for the debriefing sessions.
Mhm.
That tools you have to use it for that for that the checklist for the procedure. It depends on that the what the protocols and SOPs you are having.
So again, we need to prepare like OSCE like a checklist only for the simulation
Yes,
driven also.
not the OSCE checklist, but the procedure part has to come into that checklist.
Uh-huh. Does it assess a group or an individual in
The
simulation?
team dynamics, wherever you are having that the communication and the team dynamics, that yes, of course, that the it evaluates at the group.
Hmm. Okay, so thank you.
Anyone, any questions you can ask? We have the couple of experts from other country. Dr. Liz is with here from US. She is the uh, advanced certified simulation expert. She is also here in the webinar. If you want to ask any questions, you can ask. She will be the source to give an answer. I
So actually, do we use simulation as a teaching method or assessment method, sir? What is the uh, uh,
Or
priority of?
if you do not teach through simulation, then how you can evaluate through simulation. The
Oh,
simulation as the teaching method is also, and it's evaluation method also. Yes.
yes.
Sir, I have one query about psychiatric nursing. So,
Yes.
my teachers and I sometimes feel very cumbersome to create a scenario. Creating scenario is much easier as compared to designing the stations, OSCE stations. So, I mean, very limited things we have to design OSCE stations for psychiatric nursing. So, if you can help, if you can, I mean, support us in
Yeah, I
providing.
know that I can truly understand. This is the query which many of the colleges they ask especially the professors and the faculty from mental health nursing. But the good thing is that you can do a lot because the students are having the most challenging time when they interact with the mental health patients. And for that, of course, ma'am, you have to have that the standardized patients who can act as like that the different diseases of the mental health patient because you cannot do on dummies, right? Even if you are doing it on the miss, but you have to speak on the behalf of the patient there. When they do that, the mental status examination, when they ask the questions but you have to allow them to talk, and it can be done very nicely.
Yes, sir. That is what I'm saying. Creating scenarios are easier as compared to
Yeah,
creating the stations, the checklist
right.
preparation, because the communication, it is not limited to only one thing. I mean, they can use different techniques when they're
Right.
communicating with the
See,
psychiatric patients.
and that the best method which you can see, because in the communication with that the mental health patient, it's a scenario which is having a lot of triggers into it, right? Because you are expecting from the patient this answer, but patient reply to you something else. Now what to do? What will be your answer? If the patient is repeating the same thing, how you will come up with that? So there are the different things which you can make it, because you have lot of triggers which you can act it in reality. Instead of making, I truly understand that the making the scenarios is very easy and the AI is helping to create the scenarios very fast. But implementation of it has to have the triggers, and you know that the what is happening in the reality when you go into the mental hospital and then interact with those candidates. Anything
Excuse me.
else if you want to ask? We have that the OSCE solutions with us. You can contact us for those OSCE solutions. We have a training program for the faculties, as well as we have the program for the nursing students too, for the OSCE. And if you wanted to contact us, you can contact us. Let us know. We can help your college to start it, and later on train your faculties also, so that they can do that OSCE based assessment they can start in their own colleges. And that's the reason we started this webinar, because the many of the colleges, they are asking about the difference between the OSCE, the simulation based. So we thought, okay, give that the overview, uh, that what is exactly the OSCE has to be done. So if you want, we can help you to uh, come to your college, help you to conduct that OSCE stations, how to develop it, train the trainers and the faculties, because as I said, that the trainers training is the most important part to conduct that debate OSCE. So, so thank you so much. We have the next session on 20th June, the last session of this webinar series, and we'll see you on 28th June. Thank you so much. Thanks.
Thank you, sir. See
Thanks.
you next session.